Hypertension is one of the most common conditions seen in primary and secondary care. It is a term used to describe high blood pressure. But first, let's discuss what is blood pressure. Here is our heart, slightly on the left side of the chest. Blood from head and neck, upper part of the body, and lower part of the body comes back to the heart through veins. Our heart acts as a muscular pump and pushes the blood back to the body through arteries. So veins, they take blood towards the heart, and arteries, they take the blood away from the heart. So when the blood is flowing through the artery from one side to the other, it exerts some force against the arterial wall. This force or pressure is actually the blood pressure. So blood pressure can be defined as the pressure through which the blood flows against the arterial wall. Blood pressure is actually the product of two things: cardiac output and total peripheral resistance. Cardiac output is the amount of blood the ventricles push out of the heart each minute. It is almost 5 liters per minute. So any condition that will increase the cardiac output, like hyperthyroidism, anemia, exercise, then it will increase the blood pressure too. Total peripheral resistance is the friction present in the artery through which the blood has to flow, and it depends on the width of the artery. That means that if the artery is narrow, then there will be more resistance, leading to increased blood pressure, because it will be difficult for the blood to pass through the narrow artery. But if the artery is wide, then the blood can pass through it easily because the resistance is less, leading to low blood pressure. Normal blood pressure is defined as 120/80 millimeters of mercury. The numerator represents systolic blood pressure. It measures the pressure in the arteries when the heart contracts and pushes the blood into the body. The denominator represents diastolic BP. When the heart relaxes, the blood pressure in the arteries drop, and that's the diastolic blood pressure. The most common type of hypertension is called primary hypertension or essential hypertension. This accounts for about 90 to 95% of cases. We call it primary hypertension when there is no known cause. It usually develops gradually over a long period of time. So now we don't know the cause of it, but we do know some risk factors that makes a person more likely to develop primary hypertension. The risk factors are further divided into modifiable and non-modifiable risk factors. Modifiable risk factors means the ones that can be changed, and non-modifiable means the ones that are not under our control. That means they cannot be changed. Amongst the modifiable risk factor, number 1 is obesity. The more you weigh, the more blood you need to supply oxygen and nutrients to the body. So if there is increased amount of blood volume in the arteries, it will cause increased resistance in the arteries, which will eventually increase the blood pressure. Lack of exercise makes the heart muscles weak, making it less efficient to work as a pump. So the blood pressure in the vessels will increase, trying to compensate for it. Similarly, repeated binge drinking can damage our heart. So when it is not pumping efficiently, the blood pressure rises to compensate for that. So generally, males who are less than 65 years of age should not drink more than 2 drinks per day. And males who are more than 65 years of age, plus females of all ages, should not drink more than 1 drink per day. Chemicals that are found in tobacco damages the arterial walls. So this will lead to increase in resistance in the arteries, therefore increasing the blood pressure. Surprisingly, passive smoking also has the same effect on our body. We know that fluid tends to follow the salt in our body. So if there is excessive salt intake, there will be increased water retention in our body. Therefore, it will increase the blood pressure. The factors that are not under our control include age, since hypertension develops gradually over time. So increasing age is considered one of the risk factors. It is more common in males who are more than 45 years of age and in females who are more than 65. Genes also play an important role in the development of hypertension. It runs in the families. So if the parents have it, then their children are at increased risk of developing hypertension. The Afro-Caribbean people are salt sensitive. So in this way, they will retain more water, causing increase in blood pressure. These were the risk factors for primary hypertension. I'm sorry for my handwriting. I'm not really good at writing on my iPad. In around 5 to 10% of cases, we do know the cause of hypertension. That's termed as secondary hypertension. It's usually due to renal disease or some endocrine disorders. It can also occur in pregnancy, or some drugs like steroids and OCPs also raise your blood pressure. But we'll discuss these in depth in another video. That's it for now. We will discuss primary hypertension in detail in the next lecture. Thank you for watching this video. If you like it, then do share it with your friends, follow me on Instagram, and subscribe to my YouTube channel. Take care. God bless you all.